While you may fear the pandemic coming back, there's one problem that has never left and in fact may have gotten worse during the COVID-19 pandemic.
Yeah, the Department of Health has some startling statistics about opioids and the impact on Hawaii.
To get an overview of the opioid crisis and its impact on Hawaii, I'm joined by Dr. Engel and Dr. Wright of the Waianae Coast Comprehensive Health Center. Thank you so much for joining us on Living 808.
Thank you for having us, Tanya.
Of course, let's get right into it. This is an important issue and it is having its impact in so many different ways. Give us a snapshot of where we stand with the opioid crisis.
The crisis is ongoing, and it unfortunately seems to be only getting worse, even under the pandemic that we're currently experiencing. This is a tragedy that seems to be particularly American. It started in the 1990s with the push for expanded use of opioids, and subsequently, as efforts were made to try to contain and limit the supply of prescription opioids, simultaneously heroin and heroin cut with fentanyl were introduced. And we're now up to over 50,000 cases of fatal overdose in the United States annually, which means that over the past 20 years, there's been about 500,000 deaths, which really puts it in the same category as the COVID pandemic.
Let's talk about the Waianae Coast Comprehensive Health Center's response, and in particular in relation to COVID.
Most of our visits now, I think more than half, are virtual visits by phone or by video link. But one thing we haven't done is to cut back on drug testing. The central aspect of our program is a recognition of the need to identify comorbidities, substance abuse, depression, and we've continued to do testing at a high rate. Much of that is done at the patient's home using saliva. There are a lot of other aspects of how we've responded, and I think I'll have Dr. Wright talk about those as well.
Yes, tell me about your partnership, why you decided to partner to address this crisis.
Yeah, Dr. Engel and I reached out to one another about a decade ago because we were, I think, just getting sick and tired and beyond frustrated with treating patients for chronic pain and substance use issues in silos. And we decided to get together and partner, and we've learned that it really does take a village to treat chronic pain and address the opioid crisis. And our whole goal is to practice compassionate, effective healing medicine together.
What would you say is the future of treatment?
Yeah, I think the future of treatment is going to be somewhat similar to what we're doing. It's going to be reliance on teams, recognizing that opioid use and chronic pain are really a complex set of problems which require an adequate response. And as much as we can value the skills of one individual, teamwork just seems to be a better way to address the complex problem.
I think it's important that we continue to fight the negative social stigma of addiction and start treating it and looking at it as the medical condition that it is. Because of the negative social stigma that surrounds addiction still, we're finding that a lot of people are really hesitant to reach out and get the help that they need and that's available to them. But once we start acknowledging it is a medical condition, then people will start coming in, hopefully getting the treatment they need, and then we can start fighting this crisis and bringing down those death numbers.
An important issue affecting a lot of people. So, of course, we'll post the link to the Waianae Coast Comprehensive Health Center. You can learn more about the services available there.
I'm glad there's folks like that that are helping out.
And we have